My name is Brooklyn Adams, and today I'm going to be doing my presentation on the neurological disease known as pica. So, when it comes to pica, it is defined as a mental health condition where someone has a compulsive habit of swallowing or digesting inanimate or inedible objects. These objects can be anything from things that are typically harmless, like dirt or baking soda or paper, to things that can cause poisoning or even death, such as lead, sharp objects, and sometimes even feces. It's often seen in children, and as I said, it can range from harmless to potentially deadly. The Cleveland Clinic listed some of the symptoms of pica as eating non nutritious food for over a month, ingesting substances not related to cultural norms or traditions, or eating substances that are not developmentally aligned. This last one is very important to keep in mind if you suspect someone may have pica, because a lot of children, especially children ages 1 to 2 years old, have a habit of putting things in their mouth to explore their surroundings. This can get confused with pica, but it is actually very normal for their time in development. And it is recommended not to take a child in for a pica diagnosis unless they're over 18 months of age. There are multiple physiological systems affected when someone is suffering with pica. The gastrointestinal system is a big one to worry about. Blockages, constipation, and bowel obstructions from objects that are not meant to be digested can happen. The dental system is also one to be aware of, especially when someone with pica is eating sharp objects or hard objects like rocks or gravel. Broken teeth and other dental issues can be a big factor. There's also things that one can eat that can cause erosion of the teeth and mouth. And then also the endocrine system is not as common of a system to be affected. However, it is one to be aware of as well. If someone is eating, say, lead or some other kind of poisonous substance, it can cause seizures, mental delays and disabilities, and even death, all things that affect the endocrine system. The etiology of pica is still kind of up for debate. Since pica is not a completely recognized disease, it doesn't have a lot of information around things that may cause it. However, it has been linked to things such as anemia or malnutrition. These two things are big. If someone is having a deficiency in, say, iron, they may seek out things that might have that, even if it's not necessarily food, just to fill that deficiency. Pica is often seen in kids who suffer from malnutrition as well, just because they need a source to get energy from and they don't really know any better. Pregnancy is also common since a lot of pregnant women have very strange cravings. The risk of pica definitely goes up. And then also mental disorders, people with schizophrenia and OCD are a lot more likely to develop pica as opposed to those who don't suffer from those. As far as the pathophysiology, it's really split into two sections. Ones that are deficiency related. The hypothalamus is in charge of that. It senses a sort of deficiency and then sends signals to find the cures. As I said before, if someone is deficient in one area, such as anemic or some other thing, the brain is going to try its best to find things to cure that, and they may not always be things that are edible or should be eaten. When it comes to more mental illness related, it's often be from an imbalance of dopamine, a neurotransmitter fault, or even structural changes to the brain, such as a lack of gray matter. These are the things that cause OCD, schizophrenia, and other mental illnesses that sufferers from pica may have. The diagnosis for pica is pretty easy. As I've said before, if someone is eating inedible objects for over a month, has been asked to stop and told the dangers of it, and still just can't stop eating it, that is one clear sign they may have pica. It is very important for people to do blood tests to test for those possible deficiencies that may be causing that compulsion, as well as examine for potential neurological issues like autism or the other mental illnesses that I talked about before. As far as treatments go, there is not like a pill that one can take to cure pica. However, multiple therapies have been proven to be beneficial. Aversion therapy, such as positive reinforcement when someone eats something food related, and negative reinforcement when they eat something that pica would cause them to eat, has been beneficial, as well as just behavioral therapy, teaching people to curb those cravings and how to ignore them in a healthy way. Also, of course, getting relief from whatever deficiency is causing those with pica to seek out the inedible objects they're eating, or medications for the mental disorders that someone with pica may be suffering, are very beneficial, as those really get the root cause of what pica is. For the disparities, the socioeconomic ones are probably going to be the most prevalent. Pica is a lot more prevalent in foreign countries where there is not as many resources, or where eating things like dirt, gravel, and not super edible objects isn't as frowned upon and may just be seen as a funny quirk or a developmental delay. And also, places of low economic status tend to bring about pica. As I said before, people who are dealing with malnutrition are often going to have pica just because they don't have enough to eat that is edible. So, people who may not be able to afford food are more vulnerable to that. Also, in some cultures, eating non-edible food is actually normalized, or because of a cultural reason. An example of this would be in Thailand, where there is a festival where people eat dirt, kind of to cleanse their bodies. If you go to Thailand and you see people eating dirt during this festival, you're not going to assume they have pica because it is for a cultural reason. Younger children are at risk of pica more than adults, um, partly because of their development, and also just because a lot of younger children are not as good at impulse control. And then also, developmental disabilities may. People with developmental disabilities are more likely to develop pica just because they also don't have that kind of impulse control or don't understand the reasons behind their cravings. So, to summarize, pica is a neurological disease where one eats non nutritious or inedible substances. They can range from things that are non harmful to extremely harmful things that can even be poisonous or deadly. It can cause severe harm to the gastrointestinal system, dental system, and endocrine system. Blockages, dental delay or dental decay, nerve issues, and even death are all very possible and very real risks. Causes for the disease include nutritional deficiencies, pregnancies, malnutrition, and neurological or mental health issues, to which blood tests and examinations are very helpful. And treatments involving therapy for unlearning these topics, such as aversion therapy and behavioral therapy, are definitely the go tos when it comes to curing pica. The reason why I wanted to work on this project was because I actually watched this show called My Strange Addiction when I was younger, where people would eat things from sofa cushions to the ashes of their like deceased husband, from one case. So it was definitely very fun to research this disease and learn a little bit more about it, besides just for the reality TV showness that I had, or the reality TV show understanding that I had of it. It's a very complex disease that definitely needs a lot of research and a lot more studies done on it, but it was very interesting to learn about. Here are my references that I have, and I appreciate you taking the time to listen to me. Thank you.